Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. MALLOR GRODNER Attorneys providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.
Coming up on Indiana Newsdesk. It's been a year since COVID-19 arrived in Indiana. Tonight we're reflecting on the Hoosiers we've lost during the pandemic and those who stepped up and became heroes.
You may know there's a very good chance they're not going to survive, and you can't let their family in to see them.
We were together almost 59 years and married a month shy of 56, so we had a great time, and that's what made losing her really tough.
The pandemic ground the economy to a halt, and a record number of Hoosiers turned to food banks. And with students, we're talking about learning loss.
Just like many parents, I still have to work. There's still bills that need to be paid. It was difficult to arrange all of that to make sure that somebody is with them doing the things that they need to do.
Those stories, plus the latest on statewide vaccination efforts, right now on Indiana Newsdesk. Welcome to Indiana Newsdesk. I'm Joe Wren. Indiana is approaching a milestone. It's been a year since Indiana recorded its first COVID-19 fatality. The pandemic toll is staggering. Nearly 12,500 Hoosiers have died. The first confirmed death was Roberta Birdie Shelton. Shelton died at Community East Hospital March 16th, about a week and a half after she started feeling sick. She lived in a near East Side Indianapolis neighborhood and was well known for her fundraising efforts for those in need. Friends have scheduled a celebration of her life for March 21st, a year and 5 days after her death. Well, there's a division between heartache and hope as people try to get back to normal a year into a pandemic that has touched every aspect of our lives. Videographer Joy Mendelia has this look back.
We have been preparing for this possibility, and I want to stress that this is an isolated case at this time.
We've directed all bars, restaurants, nightclubs throughout the state of Indiana to close their in-establishment dining option. To those who think that we may be overreacting, I can assure you that we are not. Indiana is under a public health emergency.
Today I am announcing that all K-12 schools in Indiana shall provide instruction via remote learning for the remainder of the 1920 school year.
Bringing the total of deaths in the state of Indiana to 1,007 Hoosiers confirmed to have died from COVID-19.
Let's go ahead and put home and alone.
We are ready to move ahead in a measured way.
From the city, I will be planning to issue an order on Monday, likely, that will accelerate that July 31st date.
In terms of our executive order, we will be staying in stage 4.5 through August 27th.
Today we reported 971 additional cases of COVID-19 in Indiana, which brings our total to 89,359 total Hoosiers known to have COVID.
seeing COVID-19 spread in virtually every community, every county, at different levels.
Tomorrow, an FDA subcommittee is expected to approve the first COVID-19 vaccine.
The minds, the very actions of everybody that will be a part of distributing these vaccinations. We pray that you keep us from all hurt, harm, and danger, that we continue to display compassion, the excellence, the purpose, and the team on which we are founded upon.
Well, a recent study from the American College of Emergency Physicians reports 87% of emergency room physicians report feeling more stressed since the start of the pandemic. Pat Bean reports on what it's been like for one IU Health emergency room doctor.
This past year has been trying for Dr. Drew Waters in many ways.
I think both professionally, due to the volume of sick people, was very stressful, but even more so is emotionally, spiritually, the stress was massive.
Waters says working in emergency medicine for 14 years has left him numb to a lot of things that would shock a normal person. But the pandemic continues to challenge him in new ways.
You may know there's a very good chance they're not going to survive, and you can't let their family in to see them. They can't have their grandkids there, and so to keep the family separated, knowing this could be the end, is also difficult. So there's an additional emotional, damage from that.
Monroe County recorded its first death in mid-April, and by the end of October had more than 3,500 cases and nearly 40 deaths. And that put more stress on an already strained healthcare system.
When you get admitted for COVID, you're not in the hospital for a day or two, like you might be for a broken bone. You often spend weeks and weeks in the ICU, which means there's not room for the next patient to get a bed.
So, at times, the hallways in the ER, which usually operate near full capacity, were lined with beds full of patients.
Thanksgiving hit, and then it all went south. That's when our numbers went up, and things got a lot busier here.
The post-holiday surge meant December was the deadliest in the county. Cases rose by 2,800 and deaths jumped by 42, more than the first 7 months of the pandemic combined. Waters says the staff leaned on each other as the crisis grew, and there was a great deal of support from the community. But, as happened nationally, COVID fatigue began to set in.
Eventually, support often wanes with the novelty, going away, and then just the day in, day out grind of just feeling like you're trying to prop up things is really a tough strain for everybody in healthcare.
1 year into the pandemic, cases, hospitalizations, and deaths are all declining, thanks in part to vaccines becoming more available and to people still following the CDC's preventative guidelines. But, having worked on the front lines and seeing firsthand the impact of COVID-19, Waters is frustrated by the people who have spent a year downplaying the virus.
This is not an infection that is a world-ending apocalypse infection. This is just a really bad infection that we need to treat seriously. And it has just unmasked and let us see just how woefully prepared we were systematically and professionally and socially to deal with this kind of an issue.
For Indiana Newsdesk, I'm Pat Bean.
It's difficult to understand the magnitude of the number of deaths from COVID-19 until you start talking to people who have lost loved ones. Reporter Benta Boutier brings us one local man's experience with recovery and loss.
Ken and Audrey Beckley expected to live out retirement together in their Bloomington home. Then, in August 2020, they were both diagnosed with COVID-19.
We took all the precautions we thought were those of Dr. Fauci and others at the national level, and followed those strictly. And somehow, we both got COVID.
Ken was extremely sick for a week, but was able to recover.
Audrey and me, Mike, can't think of his last name, Beach Boys, original.
5 days after being diagnosed with COVID-19, Audrey died in IU Health Bloomington Hospital.
One of the sad things about that was that, of course, I had COVID, which had struck me hard, really hard. But she was alive during this, and I had to keep going.
He wasn't allowed to visit Audrey in the hospital. Ken spoke on FaceTime with her the day before she died.
I had a chance to tell her goodbye and say everything that I wanted to say to her. Yeah.
Audrey was diagnosed with MS at 25, and Ken says one of her most admirable qualities was her positive approach to life.
She just would always say, I'm not going to let MS run my life. I'm going to control my life, at least as much as she could. Nothing's going to get Audrey Beckley down, I guarantee you that. We had been so fortunate in our lives, even during my professional careers, to travel a great deal internationally. So we got to do that. Fortunately, we weren't a couple that said, well, we'll wait till we're retired.
He says the loss of Audrey hit him hard in January.
For me, faith and prayer and the support of my friends was just of enormous importance. We were together almost 59 years and married a month shy of 56, so we had a great time, and that's what made losing her really, really, really tough.
Ken got his first COVID shot this week and is expecting the announcement of the birth of he and Audrey's fourth great-grandchild soon. For Indiana Newsdesk, I'm Benta Boutier.
Well, for months, long-term care facility residents have been isolated while some in-person, socially distant visitation resumed this past summer. It's been months since many caregivers have been able to hug their loved ones. Brock Turner spoke with one caregiver about her journey to reunite with her mom.
It's Frances with an FRANCES. And I was all in favor at the beginning of March for lockdowns. And they said, they were saying 15 days. And I thought, well, it'll be longer than 15 days. But I never dreamed it would be a year, let alone even 2 or 3 months. I thought maybe 6 weeks at the most. I still have sitting in my garage a box of pictures we were going to hang right before the shutdown. So just little things like that. She misses having someone come in to visit her, to do little things like that she just doesn't want to ask staff to do all the time. I don't expect my mother to live a whole lot longer at 94 and a half. And she does have some health issues. That's why she's there. And that could be said of anyone in a nursing home or assisted living. Their time is limited. And you've caused depression, mental deterioration, lots of things for a strategy that hasn't been all that effective. The hardest thing for me is just to see her be distressed. That's the hardest thing, and not be able to do anything about it. I mean, we've discussed many, many times bringing her to my home, but she doesn't want that either. She wants her apartment, but she wants to be able to see her family. So that's been the hardest thing for me. It could be your future. It's been a cruel thing, and I think in 20 years we'll look back at what a mistake we made.
Indiana and the federal government Centers for Medicare and Medicaid Services issued new visitation guidance this week for long-term care facility operators that allows responsible indoor visitation at all times. More than 6,000 long-term care facility residents have died from COVID-19 in Indiana, nearly half of the state's deaths. Well, the pandemic has hit the economy hard, which means more people have been relying on food support. Mitch Legan reports on how food banks have been answering the call.
The pandemic led to one of the sharpest economic downturns in U.S. history. As COVID creeped across the country and employees were laid off, increasing numbers of Hoosiers became unsure where their next meal would come from. Record numbers turned to food banks.
Right before COVID started, we were at about 3,000 to 3,500 people, depending on the month, per month. COVID happened in March. We went up to about 5,000. By December, we were at 8,000.
Chavez says after March, almost half of people making the trip to Ellettsville had never been to a food pantry before. By early September, Pantry 279 had already surpassed its 2019 numbers.
They're upset, they're scared, they're worried, people that are coming here. Will we be able to get enough food? Will we still have a house? Will we have electricity for heating and cooling?
Almost 1 million Hoosiers were food insecure before 2020. That's about 15% of the state's population. School closures cut off a vital source of food for many families. Job losses and the unknown risks of going to the grocery store added to the problem.
The need in Indiana has roughly doubled. So we've seen a disproportionate impact, and I think you can attribute some of that to the percentage of jobs we had in affected industries.
The pandemic also created problems for food banks. Shutdowns, confusion, and uncertainty led to the biggest disruption of the food supply chain since World War II. Many banks and pantries had to figure out how to distribute food safely while dealing with the new airborne virus.
We go to a pre-planned parking lot distribution with local partners and distribute food that way. We dramatically increase the number of mobiles because you can do that in a socially distant way.
Plus, the pandemic cut the overall supply of volunteers, and those helping out faced increased hours and stress.
I have tendinitis now, but I mean, my health is taking the same toll as all their health. I mean, all of us, James dislocated his shoulder, Melanie messed up her back, Jeannie had a heart attack.
In many places, surrounding communities stepped up to assist with the increased need with food, money, or time. But as spring approaches and vaccine rollout increases, donations have begun to slow. Demand is staying high.
I don't know how many years the recovery will be for the neighbors that we're feeding, but I do know it'll be a multi-year recovery and far longer than the medical recovery.
For Indiana Newsdesk, I'm Mitch Legan.
Well, schools have been impacted greatly by the pandemic, with learning being forced all online at times. There's also questions about how standardized testing will be implemented and how well it can measure student learning.
It's hard
Dana Hovius has 2 kids in the Monroe County School District. There's Billy, who's in the 3rd grade, and Lily, who's in the 7th. She's done her best to help her kids adjust to remote learning amid the COVID-19 pandemic, but it's been hard for everyone.
just like many parents, I still have to work. There's still bills that need to be paid. And, it was difficult to arrange all of that to make sure that somebody is with them doing the things that they need to do.
Hovius' boyfriend would stay home during the day to help the kids with school, and she'd take over at night after work. Lily says she's missed being with her friend group during the pandemic.
It's kind of weird, to be honest. Like, we used to sit at like a big table together before this happened, and we would like sit next to each other, and like we were able to talk about what we wanted to do next.
The school corporation has since allowed in-person learning, but another hurdle for students remains: standardized testing.
After all that they have done, and then you're requiring them to do this other thing that is stressful.
Statewide assessments such as the iRead, iLearn, and iStep are required this year, despite calls from parents and even some school officials to cancel standardized testing like last spring. Hovius says teachers have been forced to cut or pare down important instruction for the remote format, leaving her kids unprepared and anxious.
I've been really nervous because I don't know what they're going to do for testing this year.
The administration at MCCSC has questioned how this year's assessment provides reliable information about students' learning. But federal and state education officials say the opposite, saying learning loss makes standardized testing more important than ever.
We need to have a measure of where students are right now. There's no doubt that the last year has been challenging for everyone, educators, students, parents.
She says this year's assessments are for gathering information, and the state is working to avoid penalizing students or schools for their performance. Indiana schools will receive $1 billion in the second round of federal CARES Act funding. Many districts plan to use the relief package for learning recovery. Lawson says assessment data can be used to identify the students who need the most support.
It's critical that we're addressing educational inequities that just have been expanded even further. We've always seen that students of color and students from low income face more challenges than other students.
One education researcher says the state should prioritize measuring whether schools are providing adequate support and empathetic instruction rather than what students have learned in the past year.
Before we even think about testing students' learning, we have to think about whether students are in a position to be able to learn.
If the goal is to measure students' learning, Calarco suggests surveying teachers and parents about the progress their students have made and the challenges they've faced. The COVID-19 pandemic has meant many of us are spending more time alone or at home than we normally would. And in many areas around the state, that led people to turn to substances at record numbers. Mitch Legan reports.
March 2020 was an uncertain time for everyone, but it was especially stressful for Christy Crowder.
That's the number one thing that we tell people when they get in recovery is, find a support system, find a recovery community, and all that, went away really quickly, when the pandemic hit.
As someone in long-term recovery herself, she saw the pandemic and initial lockdowns create new stress and disruptions for people in recovery and those who assist them.
We had all those thoughts, what are people going to do? The meetings are going to get shut down, therapy, counseling.
Substance abuse skyrocketed when the pandemic hit and the state locked down. With people confined to their homes, losing jobs, and isolated from family, friends, or support groups, alcohol sales spiked. Many counties experienced record overdose numbers.
The beginning of the lockdowns kind of highlighted, what can happen when we don't have those services.
Before the pandemic, Indiana was trending in the right direction. The state's work strengthening its infrastructure for treating substance use disorder had led to a decrease in opioid prescriptions and an increase in available treatment. Overdose deaths were decreasing between 2 and 3 times the national average. Down in Clark County, which was rocked by the opioid epidemic earlier in the decade, much of the progress that had been made was upended.
There's a loss of structure, and that was absolutely devastating to the recovery community down here. And we saw a major upswing in overdoses.
Statewide, overdose events increased by 50% in 2020, and administration of naloxone, the drug used to reverse the effects of an overdose, increased by nearly 70%.
When emergency departments began to change the way that they did business due to COVID, we had to pull back on a lot of those supportive structures.
The state expanded its recovery network to provide for more peer-to-peer recovery services. And as Indiana reopened, overdose numbers began to level out, but they're still above past numbers.
COVID has really disrupted the model that we have built, but as we begin to see COVID, the COVID restrictions lessen, we begin to see our model come back online and see the positive results again.
For Indiana Newsdesk, I'm Mitch Legan.
While Indiana has seen more than 12,000 deaths from COVID-19, cases, hospitalizations, and deaths have declined to numbers not seen since last summer. And the majority of counties in the state are in the blue range, with positivity rates less than 5%. And joining us now to talk about the pandemic is Graham McKean, the Assistant Director of Public and Environmental Health at IU. Hello, Graham. Been a year since the pandemic began. Do you have any updates for us right now?
The best update I have is, the vaccines are coming and the supply is going to really cascade here the next few weeks. And we are getting really excited here locally as we're partnering with Monroe County, and we're going to transition their vaccination site for the community to Assembly Hall starting March 29th here in Bloomington, and really hope to be able to expand capacity and increase some of the vaccine uptake in the area.
Do we know yet about how long the vaccines will provide protection against the virus? Is this going to be something like the flu where you get a shot once a year, or is it too early to know that?
I think it's too early. It's still, unknown at the moment, simply how long this immunity lasts, because we only have a few months of really solid data. That data is looking really good so far. So, at least a few months of really strong response, and I anticipate much longer, but likely not a lifetime. I think the fact that the CDC's new guidance for fully vaccinated individuals, they removed any reference to time period, which is promising. And they, appear effective enough against variants so far. And all of them essentially guarantee you that you will not be hospitalized or die from COVID-19. And so we have some studies looking at booster shots of the existing vaccines. We also are tweaking formulas of the existing vaccines to be more effective against those variants. And honestly, we're just getting a lot of really great real-world data now from places like Israel. One study from just 2 days ago for the Pfizer vaccine that showed 94% protection from asymptomatic infection, 97% from symptomatic. So they're amazing. They're amazingly safe, and they have great safety profiles. And everyone should certainly get one. This is their only way of going forward.
Just have about 30 seconds left. There's talk of another wave coming due to the variants of the virus. So do we still need to be vigilant?
Oh, yes, certainly need to maintain that vigilance for now, but we are getting this home stretch. But we also need to realize that we still have over 50,000 cases and over 1,500 deaths per day of this virus in the United States. We had nearly 1,000 cases and 30 deaths in Indiana today. And this is with a decent chunk of folks previously infected or now vaccinated. So we have to continue those measures for now in the near term. And this plateau, this slower decline, that might be what we're seeing with these variants now. You might see some continued plateau, maybe some slight increases, but I personally don't think we're going to have another massive wave of this virus because of this arms race between the vaccines and the variants.
Thank you very much. Appreciate your time.
Thank you, Joe.
Well, Bloomington is playing a major role during the COVID-19 pandemic. Catalent has been producing the Moderna vaccine since December and is now doing the same with the new Johnson & Johnson vaccine.
But specifically for Janssen's vaccine, what we're doing is taking that bulk drug substance that Janssen is providing, and we are, formulating it into a finished state, and then filling into vials. We do 100% inspection on all those vials.
Now, before the pandemic, Catalent broke ground on an addition to its facility on the west side of Bloomington, has added more than 1,300 workers. Well, that's the end of this program, but our work continues online as we cover the news throughout the week at WTIUnews.org. Have a great weekend.
Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in southern Indiana. More information at smithville.com. MALLOR GRODNER attorneys providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.